Share. All right, so we are going to make a quick video on chapters 45 and 46. We're going to zoom back and forth between the textbook and your PowerPoint. So while you're following along, we're going to start with the textbook. In chapter 45, the medication that we'd like you to be familiar with is called cyclobenzaprine. These medications are muscle relaxants. And as we've pointed out, this chapter is all about muscle spasms. We want you to learn new words such as spasm and spasticity, etc. Anything else you want to focus in on in terms of vocabulary?
Well, you should review from 221 tonic and clonic.
So if you're not already familiar with those terms, spend some time reading it. And if you have any questions, please post those questions on the discussion board or bring them to class.
And I'm sure quite a few of you have experienced muscle spasms in your lifetime.
Oh, potentially.
So, there you go.
All right. So one thing that we do want to point out, maybe I can maximize this here, is that when you're treating the muscle spasms, these medications work on the central nervous system. And so they do put clients at risk. They cause central nervous system depression. So keep that in mind. These medications that relax the muscle spasm at the neuromuscular junction will depress the CNS. So think about that. If you're giving this medication to a client, what will it do to their level of consciousness? What will it do to their just their neural activity in general, etc.?
Yeah, so they might want to take them going to bed if there's a way, like if, let's say they're having muscle spasms in their back and they're on baclofen, then let them know that it is going to cause them to be extremely drowsy during the day. So if potentially they may want to just take it at night going to sleep so they can sleep better without pain.
Yes, and over here on page 2, where is it? Sorry, over here on page 647, become familiar with the term spasticity and dystonia, so you can read those on your own. And if you have questions, please bring them to class. The medication, however, that we want you to focus in on. So if you don't already have your template out, we'd like you to pull that out right now. Because when you're reading this in your drug guidebook, there's some important things we want you to be pulling over or carrying over from the drug guidebook. You'll notice anything that's bolded, italicized, or underlined, or made to stand out by your drug guidebook is important information. And some of the things that we feel are important is that the maximum therapeutic effect may not take effect for 1 to 2 weeks. So often patients might get discouraged and might not feel the full benefit of the medication. Or they might get side effects that affect the central nervous system over here that cause nausea, maybe dizziness, lightheadedness, or sleepy, and they really don't want to take this medication. Some adverse effects to watch out for, again, drowsiness, blurred vision, dry mouth, rash or tachycardia. If any of these develop, these are things you want them to report immediately. Cyclobenzaprine should not be used within 2 weeks of an MAOI inhibitor. Star, bold, nudge.
I think you'll be talking more about those MAO inhibitors in a week or two.
Right. Right, so we're going to the next page. And this is meant to be a quick overview. It's not to replace your reading. We're not going to discuss or expect you to know a lot of information at the cellular level. This is information you should be getting in your biology class. So you don't have to spend a lot of time memorizing any of the dendrites or anything of the neurosynapses here. But what we do want you to focus in on is the nursing consideration, the role of the nurse with antispasmodic therapy. So read this section very carefully. And if you've got any questions, please write them out or post them on our discussion board. And this outlines the nursing process, what you're going to assess before giving these medications, some potential diagnoses that clients might experience and be put on these medications or might coincide with this. Anything you want to chime in about?
The only thing, just to go back a little bit, nursing considerations, if you notice, I wish they could see me pointing. Oh, point with your cursor there, yeah. Clients should be warned against abrupt discontinuation of treatment because this may result in seizures. So with these medications, you can't just stop taking them like so many other medications that we've talked about.
In fact, I know of somebody this week that wanted to abruptly stop this medication, and it wasn't until the nurse provided them with the education to say stopping this medication abruptly could result in a seizure, and they weren't epileptic, so they had no idea that that was even a possibility. They had been told this or informed of this by the pharmacist or the doctor when they were originally prescribed this medication a long time ago. And so they had forgotten it and they don't have a history of epilepsy, but that's still something very important to remind them of. And also, do not consume these medications with alcohol or any other CNS depressing medications.
Yes.
So it continues on over here. Monitor their level of consciousness and their vital signs. Monitor muscle tone, range of motion, degree of the spasm. Hopefully it will improve. And again, how many weeks should it take for the therapeutic effect? You'll remember that from the last page. You'll have to do some patient teaching or education. All that's right here. So try to decide what's important. And as Professor Smallhorn mentioned, advise the client that to avoid abrupt discontinuation of treatment, it could result in some negative side effects.
The other thing too is don't forget to be teaching them the non-pharmacologic measures such as heat or cold. Heat works well for muscle spasms, so they may need to be using that sort of thing.
Yeah, so coming back to your PowerPoint slides, we have bolded and color-coded a few things for you. So make sure that if you're focusing in, know that your clients, these medications will cause drowsiness and dizziness. Monitor for withdrawal reactions in case they stop abruptly and haven't told you. Watch out for their muscle tone. Muscle relaxants should never, I should change this to never, be taken or combined with alcohol or other medications that depress the CNS. And as we've already mentioned.
And if you notice up at the top there, clients with liver disease, as we've mentioned before, if they have liver, renal problems, then that's going to potentiate any kind of drug toxicity. So we always want to watch for that.
And here's the medication that we expect you to know, Flexeril or cyclobenzaprine. You can look at how it works. It works by inhibiting the upper motor neuron activity of the CNS. That sounds a little bit wordy for a pharmacology class, but I think what we want you to appreciate is that it affects the central nervous system and it depresses the central nervous system. If it's bolded, color-coded, or underlined, it's important information to make sure that it is on your drug template. Primarily, this medication is used to treat local muscle spasms.
And on the bottom there where it says adverse effects anticholinergic. So remember, cholinergic is rest and digest. So anticholinergic means it's going to mimic the sympathetic nervous system. So think of yourself going into a test. You have very, very dry mouth, tachycardia, every urinary retention. So you're going to be possibly seeing these effects in the patient. They may say to you, when I take this medication, I notice my mouth's extremely dry.
And this is an important point to note here. This medication is hepatotoxic, meaning it can be very dangerous and damaging to the liver. So clients need to be warned that they do need to be evaluated through if they are taking it long term, which hopefully they aren't, but if they are, their liver may need to be monitored and they may have to go for periodic lab screening.
Okay.
All right. Well, bring any questions to the discussion board or bring those to class. Anything else?
Nope.
No?
I think that's good. We can move on to the next
Last
chapter.
but not least, just read your key concepts right here. Make sure you're familiar with that. And if any of those don't particularly make sense to you, then post a question on the discussion board. Thanks, and that's all for this chapter.
Toodaloo.
Toodaloo.